Welcome back again to Mrs. G's Tips and Tricks to help you pass your cosmetology state board exam. Today we're going to be talking about the circulatory system. The circulatory system is made up of two main parts. You've got your cardiovascular circulatory system, which includes your lungs and your heart, your veins, your arteries, and your capillaries. And you have the lymph vascular system that deals with disease and infection in your body. I'm going to start out with the cardiovascular system. I'm going to look at the heart. The heart has 4 chambers. It's got 2 atria and 2 ventricles. I like to make a simplified version of the heart like this, just to remember that A comes before V in the alphabet. So your atria are above your ventricles. Now, when we look at the body, let's look at our stick figure body. Here's my body, here's my heart and my lungs. Heart pumps the blood to your lungs to get oxygenated, and it's the good blood that flows through your arteries. It flows away from your heart. Away. So arteries are always away. That's the good blood. That's what's giving your body its nutrients and its oxygen. Once your blood gets to the far reaches of your body, it needs to turn around and come back up. That is through the veins. That's the bad blood. That's the blood that's already had all of its oxygen used up by your body. Now, how does it get from your toes clear up to your heart? Veins have valves. So veins have valves. This is what allows the system to work. Your heart beats, the blood comes up, and the valve closes and keeps it there. Then your heart beats, the blood comes up, and the valve closes again. That's what allows it to get from the tip of our toes back up to our heart again. Remember, arteries are going away from the heart with good oxygen-rich blood, and the oxygen-poor blood is coming back to the heart with the assistance of valves through the veins. And the little structures that connect the arteries and the veins are called capillaries. We're all familiar with capillaries. Sometimes people have broken capillaries on their face. It's a very common thing. And the blood goes from our heart through to our body and then comes back. This is called the general circulation. So it is circulating generally through our body. When the blood goes to the lungs to get oxygen and comes back and then is distributed to the body, this is called pulmonary circulation. This is very important. This is where the blood gets its oxygen and nutrients to feed the body. We're going to talk about the various parts of the blood. The first thing we're going to talk about are the red blood cells, also known as erythrocytes. Remember this one by looking at the E in red. Remembering erythrocyte starts with an E. So the red blood cells that carry oxygen to the body are your erythrocytes. You've got white blood cells, which help fight disease. They are called leukocytes. This one's very interesting because leu literally means white. So if you have white spots on your nails, you have leukonychia. If you have white spots on your skin, you have leukoderma, white skin, white nails, leukonychia. So that one always means white. You've got platelets, which are known as thrombocytes, and platelets help clot the blood. If you go out and you get a cut, it may be throbbing, so you can remember your cut is throbbing until the thrombocytes help to clot the blood. All of these things, all of these structures are floating in a sea called plasma. So think of the plasma as a river. These are all floating down the river through the plasma. We're going to talk about individual arteries. Every artery in the body has a matching vein with the same name. So when we learn these, if we learn the names of the arteries, we automatically know the names of veins, with one exception, which I will get to later. For now, we're talk about some arteries of the face. Supraorbital. Remember, superior means above. Orbital, it's going around our eyes, so it means above our eyes. Infraorbital, that means below our eyes. We've got the facial artery, which is divided into submental. Remember that the word mentum from Latin means chin. So you've got submental. The inferior, down below, labial. Labia means lip. The superior, above, labial means lip. It's got arteries above your lip, below your lip, and in your chin that are all branches of the facial artery. We have the superficial temporal artery. Remember, temporal is in here. This one has 3 branches to it. The frontal is your forehead. The parietal, remember parietal bone is on the sides and top of your head. Anterior auricular, remember anterior means in front of, auricular always means ear. So we've got it in front of our ear, our forehead, and the tops and sides of our head. We also have an occipital artery, which is the back of our head and our nape area. Posterior auricular, remember posterior means behind. Auricular means ears, behind the ear. Now let's get to the exemption. We've got an artery and a vein that do not have the same name. This is the only time this happens in the body. We've got the carotid artery and the jugular vein. Of course, we all know that those run up and down the sides of our neck. So the carotid artery takes the good blood up to our brain, our face. The jugular brings it back down. Your lymphatic system is made up of your spleen, your lymph nodes, and your lymph vessels. They work to pull disease and infection out of the body. I know that if you've ever had a sore throat and your lymph nodes right here got really big, that's because they were filtering out the bad stuff that was making you sick. So that's the purpose of the lymphatic system. One more system that I want to talk about is the endocrine system. In that system, you have ductless glands and duct glands. Your ductless glands or endocrine glands release substances into your body like hormones, your thyroid, your pituitary gland. That is happening inside of your body. Your duct glands or your exocrine glands, think of this as being on the outside. It is exiting the outside of your body. Those are your sweat glands, your sudoriferous glands, and your oil glands.